I can help you reduce your denials in your mental health practice. So, one of the biggest reasons why we get denials in mental health in really any practice is because verification of benefits was not done as thoroughly as it could be. So, I'm going to run through how I do verification of benefits for the providers that I work with in hopes that this will help you to streamline your process for verification of benefits. So, there are a number of ways that we can verify benefits and we can get eligibility. And a lot of times we can do that through the billing software. The billing software is quick, it's convenient, but it's not thorough, especially for mental health practitioners. We also have some provider portals that you could do eligibility on. Those are great. There's also clearinghouses that you can use to do eligibility on, such as Availity. Those are okay, but it doesn't give you nearly as thorough of information as my all-time favorite way to do verification of benefits, and that is picking up the phone and talking to a live rep. Yes, it's time consuming. Yes, you have to sit there and answer the same questions over and over and over again until you actually get to a live person, but it will ultimately help reduce the amount of denials that you get in your practice due to benefits not being verified and the proper questions not being asked prior to seeing the patient in your practice. So, I'm going to give you a quick rundown on, just how I do verifications, just to kind of help, you to maybe think of ways that you can streamline the way that you do verification of benefits to help you to reduce the denials in your practice. So first and foremost, I have a verification of benefits like questionnaire that I go through, and I absolutely ask pretty much every question on this questionnaire every single time. I like to do verifications and eligibility at the beginning of the year and when we get new patients in the practice. I also will go back in, halfway through the year and re-verify our patients just to make sure that nothing has changed on the insurance front so that we can ensure that we catch or be preventative of any denials due to non-coverage. So first and foremost, you want to contact the insurance company, get a live rep on the phone, and actually record and take down the representative's information, their name, first name, last initial. If they have a representative ID number, I ask for that as well. At the end of the call, you're going to ask for a call reference number, but that's when you wrap up the call. The next thing that I ask for is, can they verify if our practice or our clinicians are in network with this plan, with this patient's plan? And they will check to let us know if they can tell if we are in network or out of network. A lot of times we know what insurance companies we are contracted with anyway. I still like to hear the representatives say that they've checked and to see that we're still in network. In some cases, especially if you have practices that haven't kept up with credentialing or is not, I want to say, like as organized with, keeping up with the credentialing dates and all that stuff, you may not know when a practitioner credentialing is due to re-credential or renew. And so it's always good to each and every time ask, are we still in network with this plan? It's just good information to have documented. After that, I will make sure that I absolutely ask, when did this plan become active for this patient? And is this plan considered primary? Was coordination of benefits completed by this patient? If the insurance companies show other insurance on file, they will absolutely let us know this. Another thing that I like to ask is, well, can they tell us if this plan is a calendar year or a plan year? That way it helps me with information such as if there's any limits on the session. I know if the limits follow a calendar year limit or if it follows like the plan year limit. So I know how to keep up with the number of sessions a patient has had. Another thing that you need to ask for the payer ID, because we file claims mostly because we file claims mostly electronically. The payer ID is great information to have documented Some insurance companies use multiple payer IDs, so you need to know where to submit that particular claim for that particular patient. And you can ensure that you get that pretty much correct if you ask for the payer ID. Another piece of information I always ask for is the timely filing. I like to know when is the absolute last day I have to be able to file claims for this patient. This information helps me if I have to like go back and forth with the insurance company, something is denied or rejected or something like that. Or if the clinician is kind of behind on their notes, it helps me to be able to, give a little nudge to the clinician and say, hey, we're almost close to timely. So you need to get this note in before we absolutely won't be able to get paid for this claim. So timely filing is a good piece of information to know because that's a very preventable denial if we have that information and keep that at the forefront of our claims processing and claim submission. Then, of course, you also need all this information. This is usually the bread and butter of what you call in for, but make sure you ask for any copay amounts that this patient may be subjected to, as if that copay is covered until the maximum out of pocket has met, or what's the conditions of that copay. Also ask, does the patient have any coinsurance that they will be responsible for? And ask what's the conditions of that coinsurance if they are responsible for, like, are they responsible for coinsurance until the maximum out of pocket has been met, or what other criteria do we need to know about the coinsurance? Also ask about the deductible. Are mental health benefits sessions subject to the deductible? If so, what is the deductible amounts? You need to know what the individual deductible amounts is, what has been met or what is remaining. Also ask about family limits. What's the family deductible? What has been met or what is remaining? The next piece of information I love to get is, are the appointments limited or unlimited or based on medical necessity? That way we need to know if there are any limits that we need to be aware of before we start to schedule the patient, or once you get into treatment. Say, for instance, if the patient feels like they would benefit for having maybe like a group session or a family session. Some plans don't pay for family sessions. So you would need to know, yes, we can do that, but that unfortunately is not covered by your plan. Our biller has already checked, and that would be something that you would be considered self-pay for. So that's good information to have so you can know how to move forward with your treatment plan. Another piece of information that you will need to know is the group number. And I like to make sure I verify the policy holder's information, who holds the policy, is the name, the address, date of birth is correct, the relationship, and all of that information. The next thing I like to confirm is if the CPT codes that we will be billing, do they require a pre-authorization? As you know, in mental health, we have a handful of codes that we typically bill over and over again. So I like to just ask them, hey, can you check these psychotherapy codes, the intake codes, and see if, they are subject to a prior authorization, or if there's any exclusions in any of these codes that we are billing out. Then, because telehealth is so big in our industry, I always ask about telehealth coverage. Do you cover telehealth? Is it at the same benefit or is there a different benefit? Do you cover audio only? Because sometimes there are trouble with the video portions of the platform that you're using, and the session is conducted via just audio. And I want to know, will that be covered if we have to utilize that service? And then last but not least, I try to get the allowable amounts. Most of the times you can get that from your contracted rates from your contract, but sometimes you can get that from the representative. I like to keep track of that. That helps with forecasting for the revenue cycle. It helps the practitioner to get an estimate of what is expected from this plan. So if you utilize this format in doing your verification of benefits, you will reduce the number of denials that you get in your practice.